okay?
Yes, thank you.
I'll leave you to sort out the rest.
Right. Thanks, Vicky.
You're about, aren't you?
Yes.
What's your name?
Ayo Ladipo.
Any chance of a glass of water, Ayo?
No, at least not until they decided what's the matter with you. Turi Rimi.
That's me. What do they think is wrong with me?
Acute appendicitis, but they're not sure.
Well, just as long as they don't spend too long making up their minds.
Well, look, if it is appendicitis, they'll operate within hours. What part of Nigeria are you from?
Kano.
Hausa?
Yes.
I guess from your name. What are you doing here?
I might ask you the same question. Are you sure I can't have a glass of water? I'm as dry as dust.
The doctor will be here soon.
Well, at least it didn't happen while I was back home.
When were you there?
I got back 3 weeks ago. My sister got married.
Up in Kano?
No, Lagos. She lives there now.
My parents live there too.
So, this is the new arrival, eh?
Yes, Dr. Miller.
Notes, nurse.
Yes, Dr. Miller.
And the curtains. Make it snappy. I haven't got all day.
Yes, Dr. Miller.
Right, then. Okay, then, Mr. Remy. Roll over onto your left side.
Don't worry, Mr. Remy, it'll be all right.
Pull your knees up to your chest. This will be very uncomfortable.
Did you have a good night?
Did you?
What's that supposed to mean?
Nothing. Nothing at all. How is my blood pressure?
I was taking your temperature.
Oh, is that what you're doing? No, I've often wondered. As a matter of fact, my blood pressure's fine. People back here?
Yeah, something like that.
I don't care if the world knows.
You may not, but I do. Anyway, your temperature's fine.
Right, the only thing about me that is, then.
You're in a very jokey mood this morning.
Well, I've just spent yet another night out of your company. Seeing you's perked me up.
Watch it. You seem as fit as a butcher's dog to me.
How do you know? You're not a butcher
Give us your arm.
or a doctor.
Don't give me that.
Only joking.
Sorry. It's just the kind of remark you get to hear once too often round this place.
You want to fight for your rights, then?
Oh, no, I know it.
Raised any interesting voices on the old CB lately?
Haven't had time.
No tall, dark, handsome-sounding strangers?
Would you be jealous?
Would you care?
You'll be out of here in a day or two. Back to the big bad world. Back to your wife.
Vicky, I keep telling you, I'm divorced. Well, almost.
Almost.
We've been legally separated for 3 years.
That's not what you said before.
Didn't want to scare you away. Do you really think I'll walk out of here and forget you?
It's different once people leave here and go home. I don't know what I think.
I won't, you know.
Would you care to give us your diagnosis, Dr. Ladipo?
The patient's a Nigerian, right? And he was over there for a wedding 3 weeks ago. And now this happens to him. I think he may have a form of amoebiasis. It's common enough in my country.
What's amoebiasis?
It's caused by a parasite that infests drinking water in some parts of the world. It causes symptoms similar to appendicitis.
When do they intend to operate?
Well, Dr. Miller wants to go ahead immediately. But Dr. Guptara was with him, and he's still not convinced.
Well, they'll have to decide very soon.
Of course they will, but if they decide to operate and I'm right, the bowel won't heal properly. Now, you could get peritonitis and die.
It's a bit of a mouthful, isn't it? The Public Image of Nursing campaign.
Well, there's no reason why we shouldn't just use its initials, PINC, and call it PINC like everyone else.
Does everyone know about it then?
Only if they read the nursing press, and even then there's room for misinterpretation. So I thought it's high time Heath Green had its own representative.
To spread the word here?
With a little help, of course.
Well, I'm glad you asked me. What's the plan?
Well, the most important thing to do straight away is to start thinking about how to mark PINC's first anniversary in January. when I spoke to them on the phone, they suggested that maybe we organise a media watch week.
What's that?
You have a lot to learn. What we do is we organise a systematic monitoring of television, magazines, that sort of thing, to see what kind of image nurses are given on various programmes.
Well, what if there's nothing about nurses that week?
Oh, we choose a suitable week, don't worry. But what PINC needs immediately, in this hospital at least, is a lot more publicity. Look, I got them to send me these.
All right, I'll distribute them.
Don't you want to know what they are first? You needn't follow my leadership that blindly, you know. In fact, I wouldn't want you to. These leaflets simply point out what nurses can do as groups or as individuals to make people more conscious of their image.
Perfect angel.
Yeah, which is, after all, precisely what we're trying to get away from. I mean, how many nurses do you know that are perfect little angels?
Josh Jones?
Well, apart from him.
None. Not in that way, of course.
And how many do you know with big busts, tight skirts and fishnet stockings? And don't you dare say Josh again.
None.
Yet, you know from your own experience that nurses tend to get regarded as one or other of those two types. Sex object or saint.
Or doctor's servants. There's a new houseman, Dr. Miller. I.O. Ladipo
Later, Janet, later. What I want you to do now is to pass these PINC brochures out to people. I'm giving a short talk about the campaign in the lecture theatre this evening. Perhaps you can get as many people there as you can, will you?
I think most of them have seen the notice board.
Good. Better late than never, eh?
Well, my dear, at least you achieved your dream. A romantic marriage with a brilliant young doctor. Just like Nurse Anita in my book. Oh, I'm sorry, I finished it. I think I shall read it all over again, starting now. I'd have married a handsome young doctor if I'd been a nurse. Perhaps I should have been one. But it's too late now. Too late.
Morning, Miss Draper. You settling in all right? Is she okay?
Yes, she's fine. She just congratulated me on achieving my highest ambition.
Oh, yeah. What's that?
Marrying a doctor.
Excuse me.
Yes, Mr. Barker.
I still haven't quite got my bearings around here. Which is the way to the what you call it?
Just down the corridor. First door on your right.
Many thanks. Tally-ho.
Nice man, Mr. Barker.
Yeah, makes a change.
He's got a cerebral tumour. Mr. Hodge told him 2 days ago, but he knew already. All he wants is for the other patients not to know. All I want is to make this Christmas as happy as possible for him.
But who knows, Josh? You may meet a beautiful young lady doctor around the corner, waiting just for you.
I didn't know how to tell you. It's ever so difficult.
Well, if you've talked to Dad about it, I mean, it's more his business than mine, isn't it?
I never meant it to happen. It just did.
Oh, I wish I'd known something was wrong.
Will you tell Chris?
Well, he's got to know something, hasn't he?
Please, Tracy, don't tell him everything, please. Just say that we've had a row, but we're sorting it all out.
Yeah, but are you?
Well, we have at last had a really good talk about it. I mean, that was half the problem. Him hiding away at work, me just getting angry here at home. But now at least we've had a good talk.
That's what you told me to do, talk, remember?
Yeah. Well, now I've taken my own advice.
Well, I'm glad to hear it.
Tracy, I know it can't look like it to you just at this moment, but I do love your father.
Is he all right about it?
Sort of. I don't really know.
Oh, Mum, why did you?
Because I wanted... Because these things just happen. You see, your father and I haven't... why are these things so difficult to explain?
Look, do you want me to do anything? Talk to Dad? I don't know.
No, love, no. Only, please, don't judge me too badly for it.
Does John know?
Well, he knows we've had a row. And he's pretty upset, of course, but
He's got a friend at school whose parents have got a house in Gwent and he's going there for a bit to stay.
Oh, Terry, that weekend cottage.
Well, it's more of a farmhouse.
Oh, Mum.
What?
I'm glad you told me anyway.
Yeah. Well, you're a married woman too now, you know. And I had to talk to someone.
I know. Look, it'll be all right. Anyway, I ought to be going. Told Chris I'll get some Christmas decorations for the flat. Mwah. Oh. And there's one for Dad and me, all right. Good luck, eh?
How are we meant to be keeping tabs on the media? What are we looking for?
Well, basically, to see if nurses are being exploited at all. You know, showing up as glorified domestics or whatever.
Whatever.
Well, there's always a sex thing, isn't there? A nurse is automatically a goer.
What? Including DNO cable?
You know what I mean.
Oh, yeah. I'm just the old Mother Cable spread across the centerfold of Playboy. They need to have a double-sized issue.
Look, Josh, if you can't take me seriously, then forget.
Oh, I can, and I do. From what I've read about this image campaign, it's really all about women.
Well, it is, mainly. Only a tenth of nurses are male after all.
You were still there for all that, honey.
Exactly. Probably treated worse by the doctors of anything.
You're right there.
Well, I think it's better just to get on with the job. Edward says the relationship between a doctor and nurse is rather like that between husband and wife. It's complementary, but supportive.
Look, with all due respect to Edward, Alison, I think
Alison's right. We should just get on with the job.
Oh, so you can speak then? I was beginning to wonder.
I'm just not finding this a very interesting conversation, that's all. Can I have a walk for the rest of my break? See ya.
See ya. What's up with her?
Love.
Oh, yeah.
It is really important that we project our image so that prejudiced people like Edward get it right.
Yeah, but what is this image?
That we're professional people doing a professional job. We're not just chambermaids scurrying around cleaning up after doctors all the time. And we have to make sure that those who use us as subject matter get it right too. I mean, after all, these TV and film people aren't nurses, so what do they know about it?
So what sort of things should we look for?
Hey, I'm reading that.
Let's have a look at the local sex cinema. There. Now, you look at that.
Look what?
There.
Oh, yeah. Roxy Cinema. Rita Pluvier's delivers more than just a cup of cocoa in Not Now Nurse. Programs daily, 5 p.m., 7 p.m. and 9 p.m.
See? It's perfect.
I didn't think people had lovers' tiffs after they were married. At least, you know what I mean.
Yeah, of course I do. Come here, you.
Yeah, what's all this then?
Chris,
What?
promise me you'll never go off me.
Are you kidding?
Promise me.
Cross my heart.
Mwah.
Look, if it's just a lover's tiff they've had, they'll get over it. All we've got to do is leave them to it.
Yeah, I suppose so.
I'll nip round and see him if you like.
Yeah, just as long as you don't labour the point. You know Dad doesn't like a lot of fuss.
No, all right, I'll play it cool. There now, how does that look?
Oh, great. Oh, I just think, our first Christmas in our own home.
Yeah, not quite our own home yet. Which reminds me, we ought to have a look at those estate agents lists I got.
Yeah. I ought to get a menu as well, you know.
You what?
I don't know, something simple that looks really fantastic.
Trace, what are you talking about?
Didn't I tell you? I've invited Edward and Alison over tomorrow for dinner. We've got that lovely tableware. I've never had a chance to show it off.
You've invited who? Oh, Trace, you might have told me.
Alison is my best friend, you know. Oh, I thought you'd be pleased.
Yeah, well, Alison's all right, but him? Oh, can't we get out a bit?
No.
Oh, well, if it's done, it's done. I can see we're in for a real fun evening.
Look, will you stop moaning and show me those lists?
Here you are.
Thanks.
Well, damn it all, Trace, what are we going to talk about?
Excuse me, please. 1, 2, 3, lift.
It's Mr. Appleby, isn't it?
Yeah.
Do you think he's going to be all right?
Well, he should be now. If that neighbour had left it another hour before calling the police, he might have been a goner.
Anything I can do, old boy?
No, it's okay, Mr. Barker. We'll be all right.
What's the matter with him? Is he going to turn into a butterfly?
Hypothermia.
Oh, poor old chap. I remember getting very cold once. We was in Alaska in 1931. The very last thing you must do is drink lots of brandy. More's the pity.
Best if you go back to your own bed now, Mr. Barker.
All right, I'm off. Leave you to it. But if you need any help, you know where to find me.
What happened?
Well, apparently the milkman noticed that yesterday's bottles hadn't been taken in. Neighbour thought he'd been acting a bit strangely, but she put it down to grieving over his wife.
You do the curtains?
Yeah.
I feel bad.
Don't worry. You feel much better after your operation.
I used to think appendicitis was something children got, like milk teeth.
It's a lot more than that. Why do you think explorers and solitary sailors and people like that have appendicectomies as a precaution?
I didn't know that. I'm sorry I was so prickly earlier.
About what? Me being a Yoruba?
No. Not at all. Really. About me letting down the PRP.
PR what?
Oh, come on, Io. Where have you been? The People's Redemption Party. Back home.
Didn't they get beaten last summer?
Temporary setback.
You're a politician.
Lawyer.
Same thing.
Could be. Anyway, I'm going back now that I'm qualified. And I don't mean to practice on Victoria Island either.
You just settle down. You're not letting anyone down. If you want to get tough with me, do it after the operation. How long were you back home?
A couple of weeks.
Drank bottled water?
No. Why?
Did you feel any stomach pains before you went?
None at all.
I see.
Hey, what's the matter? You think I might have got something else?
I don't think anything.
Thank you,
Dr. Guptara? Dr. Guptara?
Yes?
Could I please have a word?
Yes, if you can make it quick.
Oh, not here.
Very well, then. Excuse us. Yes? What is it?
This is very difficult for me to say, Doctor, but I feel it's far too important not to.
Good heavens, nurse. Would you get along with it and tell me what is it?
It's Mr. Remy, the patient with suspected appendicitis.
It's not suspected anymore.
I think there's a chance it might not be appendicitis at all.
Oh, indeed. What's your diagnosis, then?
Of course, I'm not qualified to say, Doctor, but I think we should test for amoebiasis. I'm sorry, but it's quite common in forms in my country, and it does present itself like appendicitis. And Mr. Remy has just returned from Nigeria, and...
And?
And if it is amoebiasis, then an appendicectomy would almost certainly kill him.
Well, if it's amoebiasis, we have to start drug treatment right now, or he'll probably die anyway. Look, nurse, you are speaking well out of turn here.
Yes, I know.
Dr. Miller is convinced that we are dealing with a simple case of appendicitis.
I know.
However, certain phases of this case have me worried too, especially as in my own country also.
If there's the slightest chance I'm right.
Very well, then. I'll try to get the operation postponed. Hold it right there, please. Mr. Remy is staying in the ward. Go and prepare him for sigmoidoscopy.
Yes, thank you, Doctor.
And nurse, I just hope that you are right. Now hurry.
And finally, remember that it's pride in your job that counts. Assert yourselves as people with professional work to do, and from that basic starting point, everything else will flow. Thank you.
to the crusading angel?
I don't know. I didn't see her at the flat. Mind you, she left hammer and nails and a pot of paint on the table, though.
Curiouser and curiouser. I must say, I think she might have turned up. After all, she was the one who joined us all in the coming.
I wouldn't have missed it. I thought it was a very important meeting.
Yeah, it was all just a flash in the pan, though, wasn't it? It'll fizzle out.
Yeah, if you let it.
Yeah. I'll put some tonic in it. Hope I didn't drown it.
No, I'm sure you didn't.
Well.
Well.
Here's how.
Cheers.
Looks nice in here now.
Yeah.
I've been putting up decorations in the hospital today.
Oh, yeah.
Chris turned up. He bought me a coffee.
Oh, it's nice.
Yeah, he's very chatty. Like as if he wanted to say something, but didn't know where to start.
Oh? That's odd.
He doesn't know anything about, well, our troubles, does he?
Well, I did have a long talk with Tracy today.
Oh, lovely.
But she promised me faithful that she wouldn't tell him everything. Oh, look, Dick, I had to talk to her. I had to explain.
I understand.
Do you?
You see, I've been thinking perhaps it takes something like this to show you what's important in life. Oh, I can't say it how I mean it.
I know what you mean. I might have lost you for nothing.
Same here.
What you got there?
Winter sun.
Eh?
I thought now we've got Kiss and Tracy off our hands, we'd spoil ourselves a bit after Christmas. Just for a week, if you want to, that is.
Oh, Dick, can we afford it? I mean, what about our John?
Well, your mum can have him for a visit, or Kiss and Tracy can look after him.
Well, won't they be all booked up by now?
No, I've found a travel agent. They said there's still quite a few left. Look, I've marked one or two.
Costa del Sol? We don't want to go there. I don't know, though. Anywhere would be nice with you.
See, I'm not looking for any easy answers, Sue. I don't think there are any. But I would like to try.
And me.